A very good afternoon and welcome to all our students, program in charges, counselors and regional directors. At the outset, first I would like to congratulate all those who have enrolled in this program. This is the first teleconferencing that you are attending, and I want to congratulate you for having enrolled in this very, very important program. And it is not just for your knowledge, I know that you have enrolled. It is a great responsibility that you are taking by enrolling in this program, since you are not only going to carry the message forward and transmit it to the rest of the health personnel, those who may be working under you or those who may be associated with you, but also you would help us in the management of the healthcare waste. Now, before I introduce you to the rest of the experts on the dais, I would like to inform the students of this batch that we have introduced two changes in the program this year as per the university guidelines. The first is that we never had any continuous assessment or assignments for this program, but from this batch onwards we are going to have a continuous assessment or assignments. These are a set of questions which are provided to you. These have been sent separately to you with the program guide in a letter which I had sent to all the students. In case any of you have not received the assignments, you can also download the same from the website which is present in the IGNOU website. The IGNOU website is www.ignou.ac.in. On the home page you need to go to the For Students, and in that we have download. You can download the assignments from there. The second change that has been made for all the programs across the schools in the university is that we have to have a nominal payment for the examination forms that have to be filled. This was mentioned in the letter which I had sent you because we knew that the dates would already be passed when we have the teleconferencing. The last date for filling the examination form was 31st March without any late fees, and a sum of ₹50 has to be given per course. That is, you have two courses. If you opt to appear for both the courses in the examination, you have to give a draft of ₹100. And I am quite sure that all of you are aware of it by now, and you must have already given the draft for the examination. Now we will have to begin with today a small induction meeting. Many of you may not have attended an induction meeting in your program study center, and there may also be many queries that you may be having concerning the program. So I would request our program coordinator, I am the program coordinator, and so is Professor Agarwal, who is here with us, and it is all under his leadership that this program was initiated and started, and I would request him that he would give you a brief overview about the program and the broad details of the program. Of course, all this is also given in the program guide, and in case you have any queries, kindly call us at the numbers which will be flashed on the screen, as well as you may fax us as soon as you have any questions. I would request all of you to also ask questions when we have the sessions going on with the experts, because this is an interactive session and we expect you to have a number of queries, and it would be beneficial for you if you ask questions, because the advantage of the experts who have come with a lot of experience they are having, and so we should make best use of their experience. Now I would just like to introduce the experts that we have on the dais today. To begin with, on my immediate right is Dr. Anne Matthews. She is, many of you may also be knowing her, she is the program in charge for this healthcare waste management program in St. Stephen's Hospital. Though she is a pediatrician, but she is also the nodal officer for the management of healthcare waste in her hospital, and she would be today presenting a case study of her hospital, which will help us to realize that how practically we can implement the program which you are going to study, and how in your small or big setups you can contribute towards the management of the waste. Then to her right we have got Dr. Megha Rathi, who is a consultant with us in the program. She is also a WHO consultant, and she has helped us in making the program. The program is also at present undergoing a translation in Hindi, which will be available. The booklets will be available from January 2009, and for that batch it will be open. At present we have the course only in English. To the extreme right is Dr. Abhinav Sood. He is a dental surgeon, and he is practicing. He is from Maulana Azad Institute. He is also a program a student for this particular program, and I thought that it would be very nice for him to have consented to come and give a presentation. He would be giving you an overview of how healthcare waste needs to be managed in the dental setup, and I think that bringing him and telling you that he's a student who will also be presenting is, I think, a big encouragement for the students who, if you feel that you have something to contribute. Many of the students who have been coming, as I think Dr. Ann Matthews will also bear with me, that they are already into doing management of healthcare waste, but they are taking up this program for updating their knowledge and becoming more proficient. So I think if any of you also have certain kind of case studies which you would like to present, we would be very happy if you can contact us, and you can email me on my email, that is ruchikakuba@yahoo.com. Now on my left, I already introduced Professor Agarwal, who is professor in the School of Health Sciences. He is the program coordinator of many programs, important programs like clinical cardiology, certain dental programs, and in addition he is also the program coordinator for this program. And I would request him to give an overview of the program so that you realize how the program came into inception, what is the importance of the program, and what are the various parameters, how you are supposed to go about the program in this 6 months. Thank you.
Thank you, Dr. Ruchika. Welcome once again. This is the first teleconferencing for this session, and I'm sure that the learners at the other end in the regional centers are listening to this teleconferencing, and I would also request you and the regional centers to actively participate so that it becomes more interactive. And please raise questions, please clarify your doubts, because you don't get many more opportunities to have face-to-face interaction like this. And before I go on into the details of the program, I would like to tell you that this certificate in healthcare waste management has been developed in active collaboration with the WHO Southeast Asia Regional Office, and we are very proud, in fact, that we have opened study centers outside India also, and one important center has come up in Dhaka in the Holy Family Red Crescent Medical College Hospital, where the Director General Health Services, Government of Bangladesh, has sponsored 30 doctors, and they have already conducted the 6-day contact program there, and they are due to appear for examination in June. And the WHO is also actively involved in the entire process, and we will have second batch in Bangladesh in the July admission cycle. So the July admission cycle is now open, and the prospectus would be available from next week in the regional centers. The advertisement date, I think it is going to appear next week for the walk-in admissions for the certificate programs. So please tell your colleagues and friends to apply for this program, because this, as the CPCB Gazette notification, you would refer to the Ministry of Environment and Forest Biomedical Waste Management and Handling Rules 1998, revised in 2000, that they have made it compulsory for all the hospitals and healthcare institutions, laboratories, animal houses, the veterinary hospitals to have it's mandatory for them to have a proper system of biomedical waste management. So this opportunity is a very important step which is provided by IGNOU, and we have very active participants from CPCB, from WHO, from ministries and health departments, and this opportunity must be utilized by as many as possible. And I'm happy that today we have Dr. Ann Matthew also here, who is a very active program in charge in St. Stephen's Hospital. Then you have met representatives from Safdarjung Hospital. The last batch has met. Maybe in the next teleconferencing we will have people from Safdarjung Hospital, and we would request that you try to make use of the next teleconferencing as much as possible and clarify your doubts before the examination. examinations. We will announce the dates for the next teleconferencing. We will inform your program in charges, so please be in touch. I know that the Safdarjung Hospital has already announced the dates for the first contact program, for this contact program, 6 days, and that is from 3rd May to 8th of May. Similarly, I would request that all the other institutions, our program study centers, must announce the dates for this contact program, because you have to write the project, and then now of course the assignment submission is very, very important, which has to be completed in time, and I am going to give you the dates for that. And if you look now about the details of this program, I would first like to give you the objectives of this program. You see, the 3 important objectives, as you see, is to sensitize you about the healthcare waste and its impact on our health and environment. So sensitization is important, and then we want to acquaint you about the existing legislation which I mentioned to you, biomedical waste management rules, the knowledge and practices regarding the healthcare waste management practices in the Southeast Asia, some of the countries of the Southeast Asia, and then we also want to equip you with the skills to manage the healthcare waste more effectively and safely. Well, you must have gone through the program guide that the minimum duration is 6 months, but you can complete this program over a period of 2 years. After that, you will have to re-register and pay the fee again. And the session starts in January, like you are registered already, and then again from July. So we have 2 admission cycles every year. Well, eligibility is anybody with 10+2 qualification is eligible for this program, whether they are simple 10+2 pass outs or doctors, nurses, paramedics and health managers. So those who are actively involved in the healthcare waste management, particularly in hospitals and laboratories, they must undergo this program. The admission fee for this program is rupees 2,200 in India, and it is Indian rupees 5,000 for the SAARC countries. And for the non-SAARC countries, the fee is little high. For the non-SAARC countries and non-CRO countries, here is one development which I wanted to share with you, that we are in the process of establishing one program study center, or we call it partner institution, in Mongolia. A delegation from Mongolia already visited and held discussions with us, where me, Ruchika, Megha, conducted them, and they showed very keen interest to have a partner institution or a study center in their capital town, Ulaanbaatar, Mongolia. And besides Dhaka, Bangladesh, I also wanted to tell you that in Nepal also we have opened a partner institution or center for this program. And in May, first week of May, there is an international conference in Mongolia in which one of us will be participating and hold side discussions with the Ministry of Health, Mongolia, to open a partner institution in that country. So this program is becoming very popular outside India also, and I would again request that more and more people in India should make use of this program, because we are not very happy with the kind of enrollment which is there in this program. Probably you do not know the benefits of doing this program, so please impress upon your colleagues and friends to enroll in this program. Now the admissions are open for the July cycle. Well, the program package, as you see, is comprising of the course material. We call it SIM, self-instruction material, which contains 8 booklets. That is already with you. Then we have the project guide, program guide, and academic counselor's guide for the teachers actually, and program handbook and brochures are available. Then we have some videos which we have already sent to the program study centers, so we expect that you also watch these videos during the 6-day contact program. And the 6-day contact program, the details will give you, and you must attend this 6-day contact program, because you get so much of help from your teachers, academic counselors, when you attend this contact program. The program design is also very well known to you, that we have 2 courses, BHM 001 and 002, and the credits are mentioned against these, and then there is a project also. And in addition to, these are the titles of the blocks in course 1. You can go through these. I will not repeat these names. and these are in any case with you. So you must go through these carefully, and in the next teleconferencing try to clarify your doubts, which we may hold it somewhere in May. We will announce the dates, probably we'll fix it during the tea break after 20 minutes, and then probably we'll give you the next date. And this is course 2, in which we have got 4 blocks again, and this is a little heavier block because we have a lot of practical aspects, so the marks for this are also a little more. And then of course in this, if you see, there is a last block is the training manual for the waste handlers. This needs a special mention, because not only that we train you in this program, but we want you to in turn go back to your institutions and train the waste handlers actually. And this block has got beautiful pictures. Make use of these pictures and try to train the waste handlers in the segregation process, collection, transportation, and all other important precautionary measures, PPE, protective personal equipment, post-exposure prophylaxis, various things are beautifully depicted in this. So this is something which is great. In fact, here I would like to mention that in Indonesia, the entire course material which is there with you has been translated into Bahasa Indonesia, and this particular block 4 of course 2, training manual, has been widely used in Indonesia, particularly in Banda Aceh. Banda Aceh, as you know, is the origin of the tsunami that struck Southeast Asian countries and all coastal countries in a very serious manner. And so this training manual is really very, very important. You must make use of this training manual, and then you should write a good project. We have, in this project manual, we have given various topics for the project, and during the contact program, which is listed here, 6-day activities, what you are supposed to do. On the first day, we have an induction meeting and some theory counseling, some small briefing and lecture may be taken by your teachers in the study centers. They also will conduct some field visit to the setup in that hospital, or maybe some other place also you may like to visit, and there is some field visit and theory counseling again. Project counseling is very, very important. That's what I was trying to emphasize, that you must write a good project, because that is something that you try to internalize and go into more details in that area. And various topics, as I said, are mentioned in this project manual. And then they will also play the videos so that you can see certain case studies of some hospitals and see how the system is being implemented in these hospitals. And day 6, of course, is that you should try to work out a model waste management system so that you can implement it when you go back. And then, of course, the concluding session and guidance. There are also assignments here. As you see, in June your examination is scheduled, theory examination for these 2 papers, that is BHM 001 and BHM 002. And then there is a continuous assessment, that assignments which Ruchika was mentioning, you have to submit and write those assignments and submit it in time to your program in charges, and then they will evaluate and send these marks to IGNOU so that they are reflected in your grade card. Project evaluation also has to be done locally in the study center. Well, this is the evaluation process. The continuous assessment is 30% weightage, and TEE means term and examination is 70% weightage. So maximum marks are 100, out of which you have to score minimum passing marks are 40%. So that's it. And there are some guidance tips, like you must carefully go through the program guide because it answers many of your queries. Attend the contact session at the program study center, very, very important. Attend all the teleconferences. We will announce we will announce it maybe in the second session, the next date, and submit applications for the theory term and examination to the SRE division in time. I hope you have already done that. Then send your feedback pro forma to us. That will give us a lot of help in making some changes. Contact program in charge for the immediate you should contact the program in charge for the immediate guidance, and use the IGNOU website for certain announcements, and you can contact us in case of any problems that are not addressed anywhere else, and then give all important program related details including contact sessions in your feedback. No, program guide gives the all details regarding the contact sessions and details of the evaluation plan and all these things which are mentioned here. These are the important dates. Last date for the assignment is 30th April, and theory examination dates are 18 June and 19 June.
So these are the tentative dates. They must check the dates from the website again, and they will be there on the IGNOU website. These
okay,
are the
so you will
dates,
get the hall ticket, etc., and appear for the examination. So I wish you all the best, and we will now, I'll hand it back to you, Ruchika, for the next.
Thank you, sir. I just wanted to inform you one thing, and that is, you see, as we have told you that the assignments have been included as a separate component, you should be very clear that you have to clear the assignments separately and the examination separately. I mean, you have to pass and have 40% in each component. If you do not have, then it will not be possible for you to clear and get the this thing. The certificate. So please make sure that you have a 40% marks in each of the component, and they have to be cleared separately. In case you are not able to clear your exam or your assignments, then you can please reappear in the next year. The assignments, fresh set of assignments are made each year, and examination is held 6 monthly in June as well as in the month of December. Now I would request Dr. Megha, who has been a consultant with us also, and she has been in various WHO programs also, to tell us that what does she feel as per the quality of this program, especially the material vis-a-vis the the materials may be available in certain NGOs who are also doing the training, and the various training programs, how effective they are as compared to the training programs of IGNOU.
That's a question which Dr. answer here. The IGNOU program, as all of you know, is the only university program in healthcare waste management. So the material in itself, the university and the material in itself says that it's it has a lot of weightage over the other programs, and it's in collaboration with WHO CRO, and in active collaboration with WHO CRO we have developed this program. We have more than 21 study centers across the country, and program institutions abroad. That is one thing, and we can see that it's widely been used. More than I would speak about it. I think so. The students who are using are speaking more about it. As we see, we have more than 400 students enrolled up till now, and it's just the program is just spreading across. So I'm sure it has a lot of weightage over the other programs. So I would not say they're bad, but this definitely good.
Okay, thank you very much, Megha. Now I think without wasting much time, I would request Dr. Anne Matthews to give a small, case study kind of a presentation about her institute, that is St. Stephen's Hospital, Delhi. This will help you to get an idea how the waste should be managed. I don't know whether I should use the word ideally managed, because every practical, thing that is done does have certain loopholes, certain things which are not according to the prescribed norms. Of course, it's managed very well, and I would like Dr. Anne Matthews, while she gives her case study presentation, to also tell where are the points which need to be stressed and which are a deviation from what has been prescribed. Okay.
Good afternoon, everyone. Congratulations on joining this course, and I'm sure it is going to benefit you as medical personnel or management level people. I'm going to give you an overview of biomedical waste management at the hospital at which I work, and I think at the end of the day, it is what you do practically after passing the course which is going to help you and the people around you. St. Stephen's Hospital is a 600-bedded multi-speciality tertiary care hospital located in Old Delhi, serving all sections of the society. Established in 1885, it is the oldest hospital. Hospital waste, we all know, is biohazardous, and it has a higher potential for infection and injury than any other kind of waste. And it also affects the environment. Proper disposal of waste entails development of cost-effective methods that are applicable to large, medium and small-scale settings in India. I am going to outline the management of various streams of waste in a large hospital. The evolution of good waste management will be discussed, and the key factors in improvement of our standards, which was commitment from the management and a regularly trained and disciplined workforce. The evolution of the Hospital Infection Control Committee was very crucial to improving the waste management at our hospital. In 1997, we had a part-time sister, after which, after the appointment of Dr. Sudhir as Deputy Director, it became more formalized. We had formal infection control meetings. A full-time sister was appointed, an infection control officer was appointed, and as per the Delhi Pollution Control Committee rules, a nodal officer for biomedical waste management.
I'm sorry to interrupt you here, Dr. Ann Matthews, but I would just request our students, many of you are working in the hospitals, that please come up with your questions as to, and also your, you can give your comments as to how the waste is being managed in your hospital, what is lacking, because I'm sure you must be having a lot of questions. Please don't feel any question is irrelevant, because there may be such similar questions in the minds of other students also. So we would be very happy if in between you can ask us questions vis-a-vis the case study which Dr. Ann is presenting. We can also have the numbers flashed again for your convenience. Thank you.
It is important to realize that waste management is a team effort, and we have a committee which is headed by the chairman, which is the deputy director, because we are legally bound to maintain certain standards by biomedical waste management handling rules. There is a hospital infection control nurse, officer, microbiologist. There are management representatives. These are all senior level people, and from engineering, nursing superintendent, principal school of nursing. It is very important for us to train our nurses when they are students, and a finance committee. Finance representative. Also we have nursing representatives of the ICUs and theatres, lab representatives, housekeeping and consultants of various departments. The function of the Hospital Infection Control Committee is to have monthly meetings, to organize a Hospital Infection Prevention Day, which is organized at least thrice a year to train staff, and forming of policies and continuous monitoring of waste control practices. If you look at the number, we have nearly 1,000 to 1,500 staff. Every person is generating waste, so it is very important to train these staff. Also, there could be a floating population even within the hospital, so they need to be trained as they join. The housekeeping, we have 300 staff, student nurses 150, staff nurses 370, paramedicals, doctors. Now this is how we train our nurses during the HIPD. We do it through skits or through lectures. This is one of our HIPD day skits. Then we have topics covered during this are segregation of waste, management of blood spills, prevention of needle stick injuries, occupational health and safety, proper use of chemical for waste management, and managing mercury spills.
Maybe you could just go back on that slides of the skits and just explain what is being covered in those skits.
See, we use a lot of chemicals in the hospitals, and it is when you want to impart any knowledge to anyone, the person has to think, how is this going to keep me better off? Now, if we look after the occupational health and safety of our staff, hopefully they will also do better work. Now here they handle a lot of chemicals when they are cleaning the toilets, when we are disinfecting surfaces. So we are showing them the toxic effects of certain of the chemicals they use and how they should be careful in it, and also how the sharps can give them needle stick injuries, and there are certain hazardous diseases.
This black person is a toxic effect.
This could be not the toxic, this could be the HIV, hepatitis B, HCV. These are the viruses which they could get either through blood spills if they don't protect themselves, or through needle stick injuries. So it is important to handle sharps properly. To introduce a behavior change in staff in relation to waste management, it requires strong leadership, training, and also you have to be enforcement of discipline. We have to continuously keep monitoring and reporting, and if we have anyone has new ideas, that is encouraged. I'm going to show you 3 scenes of waste generation within the hospital. One is in the immunization clinic, one in the NICU, and our blood sampling areas. We have a busy outpatient immunization where in a matter of 1 or 2 hours you will be immunizing 100 children. So there's a lot of screaming children plus lot of sharps generated. During the time when these syringes are used, the nurse doesn't have time to destroy the needles. So she just puts it on a thermocol. It is arranged like this so that when they go back to it to do the destruction, they do not get any sharps injuries. Because if you leave needles and syringes lying around haphazardly, there is a high danger of getting a needle stick injury.
I think this is an excellent example of appropriate technology over here that you've used, because I think this thermocol use is not recommended in any of the WHO books or in any of the standards. This is something which has been devised locally. So I think that is very important in your setup. It is important to see that in what can be best managed with the least possible within the economics of the setup, whether you are in a nursing home or in a hospital. It just requires little innovation with whatever material you are being used. So I think this is an excellent example, and I think people should learn and pick up from this.
Thermocol? Is it being
The thermocol is disinfected by putting in bleach. Bleach, because we don't incinerate it.
It's not sent for autoclaving or...
it could be sent in the blue bag for autoclaving. This is what again I want to say, this idea came from a nurse, and it is important that you can in your setup have ideas, take good ideas, simple ideas, non-expensive ideas, and make the place safer for yourself and for the staff and for the patients. This is the syringes, they're putting bleach into it to disinfect it. Now this is another more high-tech place in our hospital, which is the neonatal ICU, but the principles still apply, that when we are trying to save babies who are 1 kilogram and under, or just around 1 kilogram, infection control is very important. So you should have a clean area, which is where you don't put infected blood samples in that area. This is the area where they are making fluids for the babies. And this area, the doctors are told not to put any infected substances. Now, disposal of waste, which you will be covering in your textbook, it is given well. There are 2 main categories. One is the infectious and one is the non-infectious. In any good hospital, it is very important to have a good segregation program. That means the waste is put in the correct container. Now, for our infectious waste, we have the blue and the yellow bag. In your textbooks, it might be different, but in the blue bag, what we put is the chemical disinfectant, and the yellow bag has the articles which you can disinfect, which you can incinerate. This is one of the sites where all the waste generated is put. Now you can see here the doctor is segregating the waste. I think we should be aware and we should make it a practice that everything should not be left for nurses to do. If you are putting a cannula as a doctor, or if you are doing a procedure, it would be very good if you also take part and do some of the waste segregation, and especially where sharps are concerned, because if you leave a needle lying around, no one knows except you that you have used a needle. So you should be responsible for the sharps disposal, because we know that in the healthcare setting, the sharps are the main source of transmission of HIV, HCV, hepatitis B to patients or to staff or anyone who has a needle stick injury. Now this is a plastic bottle which is being mutilated and cut. This is to prevent reuse. If you have a shredder which deals with soft plastics like this IV containers, then you need to shred them. But if you don't, then it's better you mutilate them by simple procedure like cutting with a scissor. This is our blood sampling area, and you can see that the vacuettes, the blue topped and the red topped, they have a certificate for incineration. Usually where you generate, might be you won't have because these are more expensive, but after the blood sampling is over and after we have done the investigations, these are incinerated. This is how through the, he's drawing a blood sample. And then the needle tip is destroyed. And then they go for incineration. Chlorinated products like medical equipment made from PVC, IV containers, parts of syringe, IV components, labware, inhalation masks, dialysis tubes, breathing tubes and catheters, all of these are disinfected by chemical disinfection. This is because plastics cannot be incinerated. The white bag in our setup contains non-infected plastics, that is plastic polythene, empty mineral bottles, plastic cold drink bottles, plastic medicine bottles and wrappers of syringes. The blue bag, as I said, contain all the plastic waste which is infected, potentially infected. Adverse effects of incineration of chlorinated plastic equipment. It releases dioxins and furans. Dioxin has a half-life of 7 years in humans and passes to the newborns. Dioxin passes on to the atmosphere and then the food chain and eggs and milk. It results in infertility, certain malignancies. So it is important that we do not burn plastics. So the key is to first segregate it in the right container. As I said, it could cause teratogenicity, cancer, reduced immunity. How should plastic be treated then? It should be treated by non-burn technology, and all reusable items must first be shredded or mutilated and then be treated by non-burn technology, either autoclave or chemical disinfection. In the hospitals, chemical disinfection is with chlorine. Chlorine releases, the bleach releases chlorine, which is a rapid and potent bactericidal. It kills bacteria, fungi, yeast and viruses. 10,000 parts per million available chlorine disinfects blood spills of HIV, Hep B and Hep C. We use bleaching powder, and that 28 grams is added to a liter. Uses of bleach powder in the ward used for infected plastic.
The bleach powder that you're using is of what concentration? I just couldn't get that slide.
We use 28 grams per liter.
28 grams per liter.
That makes what concentration?
1%. And if you use 48 grams per liter, it makes 2% concentration.
So what is done with the blood samples and all, using the same 1% concentration?
The blood samples in our hospital, they are in the container.
Okay.
So we can incinerate it.
You are incinerating it.
But otherwise, if you have a blood spill, you can make a bleach solution, put it over the blood spill.
Okay.
Leave it for 5 to 10 minutes.
So then the concentration is more, I think so.
You can make it more than 1% or 2%, but definitely not less. And you should mix it freshly, because within half an hour the chlorine vaporizes and then you'll just have water.
So how frequently you prepare this?
We advise them to change it at least every shift.
Every shift. So it's
the bucket
almost thrice a day.
Every half an, you mean in 30 minutes the chlorine vaporizes?
It could vaporize, say, it might vaporize before, within half an hour, 1 hour, it starts vaporizing. So
and then it is not effective.
So it won't be effective, the solution. So, but it's not, we say to every shift, because people are not going to change every half an hour, 1 hour. They have enough and more work in a hospital.
Right, absolutely. So that means it is not decontaminated after 2 hours if they put into that bleaching solution, 1%?
It depends on your load also. Not only the vaporizing, it depends on the organic load, how much blood there is in it.
So, but stirring and all would help?
Stirring, we ask them to stir, we tell them to mix it and make it every shift.
Okay.
Change possibly.
And what about the blood bags? Because they are PVC, they're made up of PVC, so you don't incinerate the blood bags?
Blood bags we do not incinerate, we do not I would prefer that blood bags are not handled. There are two ways you can deal with it: autoclave it, though there is little plastic, or incinerate it,
Okay.
though it's got plastic in it, because the load could be larger than that.
Actually, here, just a small comment, we would not be very, you see, now the burn technologies are on the decline, and internationally we do not promote too much of the burning the things. So the blood bags or the plastics, even if they are not chlorinated, we should not try to incinerate the plastics particularly. And the autoclaving of the blood bags, you can cut them, you can decontaminate in the sodium hypochlorite solution, and then the plastics can be recycled. In fact, after autoclaving, they are disinfected, so they are yes, after cutting, shredding, we can dispose them off. So better we do not encourage the burning, you see, for these plastics as much as possible.
Chlorinated plastics. Yeah.
Then you could autoclave infected plastics.
Yeah.
This is when you have autoclave running in your hospital. It has to meet certain standards, so the pressure and the temperature records have to be kept. We have an operator for the autoclave who maintains it. And this was our old shredder. We have a new one for shredding plastics. And this is to prevent reuse and recycle and coming as a new syringe. It's very important to shred and mutilate all your syringes. And this is the plastic bottle being.
I think we can stop here and we can take the sharps management, because it's very important, and I would not like you to rush through it because we are almost to the close of the session. We'll be breaking in for 15 minutes, and I would like that we start with sharps management, which is very, very important. I would again request all the students to please phone in, because
we want to know if they are participating or not.
And a one-way session is of no use, because we could just make videos and send to you. So please, you must, when you can give a call on my mobile at 8 o'clock at night, I think you should be able to give a call in the teleconferencing session as well, and just ask the questions which have been troubling you for the content, as well as any administrative issues that is troubling you. So thanks a lot, and we'll be meeting you at 3:30.